Hi, I'm Dr. Lari, a sport and exercise physician and member of ASMAC, the Australian Sports Drug Medical Advisory Committee, and I'm here to explain the complex world of therapeutic use exemptions, known as TUEs. Sometimes an athlete may need to use a prohibited substance for a legitimate medical reason. A great example is diabetics need insulin to live, but insulin's prohibited under the WADA code. We don't want diabetics to not be able to play sport, and we don't want them to not take their medication. So the process of therapeutic use exemptions exists to allow athletes who have a legitimate medical condition to take a prohibited substance. There are 4 conditions that must be met for a TUE to be granted. The first is that the athlete would experience significant health effects if they weren't to use the prohibited substance. The second is the substance cannot enhance their performance beyond restoring their health to baseline. The third is that there's no reasonable permitted alternative and the only treatment available is the prohibited substance. And the fourth is that the need for the therapeutic use exemption and the prohibited substance can't arise from previous misuse of prohibited substances. For example, you would not get an exemption to treat a condition like low testosterone if that arose as a result of previous anabolic steroid abuse. Let's go through what happens if you need to take a prohibited substance, starting with your doctor's consult. As an athlete, you need to make sure your doctor knows that you're subject to the WADA code and could be selected for drug testing. They'll need to keep this in mind when they're selecting medications to prescribe to you. It's your responsibility to check with your doctor any medicine they might want to prescribe. You can use Global Dro, an online medicines checking platform, to do this. And if the medicine's prohibited, you should ask your doctor if there's an alternative that could be prescribed. If there's no permitted alternative, check if you need an in-advance therapeutic use exemption using the Sport Integrity Australia website or app, or by checking with your international federation if you're an international level athlete. If you don't need an in-advance TUE, you can take the medication as prescribed, but you should keep a record of your medical file and all the medical evidence in case you are required to apply for a retroactive TUE or details are requested by Sport Integrity Australia. If you do need an in-advance TUE, you can download the application form from the Sport Integrity Australia website. You can also give us a call to work out if you need to submit it to your international federation. You'll need to complete the form in full, collate all the evidence to support your medical diagnosis, and get your doctor to complete the medical section. Make sure you and your doctor provide as much information as possible. There are guidelines available from WADA on the evidence required to apply for a therapeutic use exemption, and these can be downloaded through the Sport Integrity Australia website. The more information you provide from you and from your doctor, the easier it is to make an assessment of your therapeutic use exemption. You then submit your application to the Australian Sports Drug Medical Advisory Committee, or ASMAC, or as an international level athlete, you'll submit your application to your international federation. So what happens then? Your application will be assessed by independent sport and exercise physicians who have extensive experience in all sorts of different sports. They'll examine the evidence provided by you and your doctor about your condition and the required treatment. They'll also ensure that it meets the WADA guidelines for granting a therapeutic use exemption. You and your doctor will be advised if your application's been accepted or rejected. For accepted applications, you'll be provided with an expiry date and any conditions on your use of the prohibited substance. If your application's rejected, you or your doctor are able to request a review of the process and your application. And remember, in the case of an emergency, you should always receive the medical treatment you require. Once the emergency is over, you can contact ASMAC and apply for an emergency retroactive TUE if any prohibited substances were administered as part of your treatment. It can seem a little daunting and complex, but don't worry, we're here to help. So contact Sport Integrity Australia with any questions you might have about TUEs and we'll guide you through the process.